and break down the possible impacts coming up a little bit later on. Dave?
All right, thanks, Doug. The controversial health care reform bill now faces intense scrutiny in the Senate. It narrowly passed in the House last night.
Bill is passed.
Now, despite the cheering, the vote was 220 to 215 with just one Republican lending support. President Barack Obama wants a final bill on his desk by the end of the year. Today, he urged senators to act quickly and decisively.
Now it falls on the United States Senate to take the baton and bring this effort to the finish line on behalf of the American people. And I'm absolutely confident that they will.
Support for the president's health care reform bill is mixed in our area. Eyewitness News reporter Robin Rieger is in Rittenhouse Square with reaction from local lawmakers.
Two Democrats, two different votes on the health care legislation passed by the Democratic-controlled House Saturday night. Congressman Bob Brady of Pennsylvania explains why he voted yes.
It's a great vote for people, again, that can't afford health care. We are now giving them an opportunity to get a good quality health care.
Congressman John Adler of New Jersey says his no vote represents his concerns that the bill is too expensive.
I'm afraid that the bill that was proposed back in June that was voted on yesterday doesn't quite contain costs enough to be affordable for taxpayers, for families, and for business in the long term.
The House bill requires large companies to offer coverage to all employees and offers subsidies for those who can't afford it. The people who say they need help with health coverage are encouraged.
I've worked contract for a long time with no benefits or benefits too expensive to pay into. So for hard-working people like myself, and when I heard that news, I said, I hope it goes through all the way.
The bill is funded with a tax increase on the wealthy and by squeezing $400 billion out of Medicare over 10 years. And others say that's a cause for their concern.
I've had doctors already tell me that they're not going to accept Medicare because it's not making the payments. So what's going to happen is people are going to go to the better doctors. They're not going to take Medicare and not going to be able to get the coverage.
Pennsylvania Governor Ed Rendell on Meet the Press Sunday said it was time to get health care reform passed.
It's going to pass the Senate. It's passed the House already. The conference committee will iron out some of the problems, and it'll be a huge step forward for Americans.
One Republican voted for the legislation, 176 Republicans against it, along with 39 Democrats. Republican Senator Lindsey Graham says the House bill is considered dead in the water in the Senate. In Rittenhouse Square, I'm Robin Rieger, CBS 3 Eyewitness News.
5 people are pulled to